Hi, I'm Dr. Dan Sullivan from Oral Surgery. I'm going to review your post-operative instructions with you. So basically, this is a pamphlet that we give all our patients, and the first thing on the pamphlet is bleeding. So you will leave the office most likely with gauze in your mouth. We'll ask you to bite down. We'll ask you to take the gauze out when you get home, approximately a half an hour after you get home. And if you don't have any more bleeding, you don't need any more gauze. If you do have more bleeding, we'll ask you to open one of these little coin envelopes that will be in a bag that you will be given, and just fold the gauze and just gently put it in the surgical site and bite down hard for about a half an hour and then take it out. That normally resolves the bleeding. If it doesn't, you can call our office and we can discuss that with you. But most of the time, that will resolve the bleeding. Next thing we're going to talk about is swelling. Swelling, you will definitely get swelling after surgery. The peak is in about 2 to 3 days and then it starts to go down. One thing that we know that helps with swelling is ice. So especially if you've had 4 wisdom teeth out or multiple implants, we'll give you this. It's called a jaw bra. It just basically goes around your head like this. And what you do is you will insert ice that will be given to you in a pouch here, and that will go in, and you put that around your head. What this does is it applies pressure to the site, and it also, the ice is going to reduce the swelling. So the pressure helps and also the ice. So that's very important to use after surgery. It greatly reduces swelling. The next thing we're going to talk about is medications. Most likely you will have been given medications. One form of medication is a pain medication, which most likely you will have been given. Another medication is an antibiotic. In some cases, you will need an antibiotic, and in some cases you will not, but definitely your doctor will discuss that with you. Sometimes we will give a low-dose steroid if a patient has had multiple implants or 4 wisdom teeth, something relatively invasive where a steroid may be warranted. The next thing we're going to go over is oral hygiene. Basically, how do you keep your mouth clean after oral surgery? The day of the surgery, we don't want you to rinse with warm salt water. We don't want you to brush your teeth. The reason is we don't want you to spit. If you spit the day of the surgery, that can cause bleeding. Another thing that sometimes causes bleeding is utilization of a straw. You don't want to use a straw the day of the surgery. The other thing we're going to ask you to do is the next day, the following day after your surgery, we want you rinsing with warm salt water. We want you also to use a plastic syringe that we're going to give you. You load this up with warm salt water. There's a plunger. You load it up and you shoot it in the surgical site. This will help keep everything nice and clean. You may have stitches. The stitches are dissolvable, so they're going to come out on their own. So sometimes you may note that when you're rinsing, a little piece of the stitch comes out. That's normal. How long does it take for stitches to dissolve? Usually about 5 days, 5 to 7 days. Another thing that we're going to go over here is your diet. What should you eat and when should you eat? Well, I recommend about a half an hour after you get home, remove the gauze and eat something. Eat something soft. Eat some Jell-O, pudding, yogurt, and then start taking the medications. Don't take the medications on an empty stomach. We'll want you to eat soft foods for about three days. I would say about a week after the surgery, you can resume your normal diet. Everyone's different. These are just averages that we like to provide for our patients. The next thing we're going to talk about is activity. What should you do after oral surgery? Well, if you've had sedation or general anesthesia, basically if you've been put to sleep, that day we don't want you to drive, we don't want you to exert yourself. Also, if you do take a medication with a narcotic such as Vicodin or Percocet, you should not drive at any time. Normally, if you've had 4 wisdom teeth removed or multiple implants, 3 or more implants, we ask that you take the day of the surgery off and a day or 2 after. If you've had a more minor procedure such as just 1 extraction, most patients can resume their normal activity the next day. Please remember that post-operatively, after your surgery, you should not smoke for at least 5 days. Smoking will delay healing and in some cases increase the likelihood of a post-operative infection. We like to see our patients approximately a week after the surgery to check and make sure they don't have any post-operative infections and that they are pain-free. I hope that these post-operative instructions have helped you. If you have any questions at all at any time, please call our office. If it's during Business hours, one of the doctors will get on the phone and talk to you. If not, we'll call you right back. If it's after business hours, our answering service will page us and we will call you. Thank you very much.